Okay, now we are continuing with our studies on echocardiogram, and today we are going to discuss about the overview anatomy of the heart, so that we can see what is seen when we are doing echocardiogram. When we are doing echocardiogram, so you see the anatomy of the heart. So the heart, we will see it using echocardiogram, using a two-dimensional ultrasound, and be able to see the right ventricle, the left ventricle, the right atrium, the left atrium. You will see the aortic heart rate. You will see the anterior ventricle walls and the posterior ventricle walls. You see the valves. All those ones you'll be able to see in this one. Now, basically, that is the gross anatomy of heart. You see the heart is on the thoracic region, surrounded by the more on the left, at the end of it is on the left part of the heart, of the chest, and it is sandwiched in between the lungs. And also remember the blood vessels, the posteriorly, it has the vertebral column, and also diaphragm is there. The diaphragm is there, it's in the cage ribs. Okay, so the heart has various chambers of the heart. We have we have the left atrium. We have the right atrium. We have the right atrium. You can see the position where they are. You can see the right ventricle, the left ventricle. You can see the inferior vena cava, tricuspid valve, which runs in between the right atrium and the left ventricle. You can see the, the left atrium and the mitral valve, which runs between the left atrium and left ventricle. You can see the pulmonary veins. You can see the pulmonary arteries. You can see the aortic valve, which separate the right ventricle or the left ventricle. The pulmonary valves is the right ventricle, the pulmonary artery. Then you remember that in the echo, the pulmonary aortic outlet is regarded as a chamber of its kind. You can see the aortic arc, the spidia vena cava, all these ones. Now, the spidia vena cava drives deoxygenated blood from all tissues of the blood above the diaphragm. So the cutting point is the diaphragm. Spidia vena cava gets the blood from the deoxygenated blood from the upper part all the way to the diaphragm, all the way the spidia vena cava gets from that from that one. You can see the tricuspid valve. Tricuspid valve. Trio means three. It has a right ventricular valve, which separate the atrium and the right atrium, the left atrium and the right ventricle. It has tricuspid, okay, right atrioventricular and right atrioventricular valves. Open to the left, the blood flow from right atrium to left to the right ventricle, and it crosses during systole and prevent flow back to the right atrium. So it crosses during systole and it opens during diastole. It opens during diastole. You can see the way it is. It has three valves. Let's see how it is. It opens like that one. That is the right atrium. It opens, it crosses during diastole. During systole, because at the time the heart pumps blood out. So you can see the pulmonary valve opens the blood from the right atrium to the pulmonary artery. The pulmonary artery. You can see that the way it moves out there is one, the blue colors, the blue correlation. Then you can see the pulmonary arteries, how they move around the transporting the oxygenated blood from left ventricle, the right to the lungs, and the only artery in under that transporting the oxygenated blood, pulmonary arteries, then pulmonary goes away. It has 4 branches. Then we have what is the right lung. You can see the right lung, left lung, it has the branches of pulmonary artery, the pulmonary artery. Then you see where the right atrium in a normal person, that's a cadaver, a blood vessel. It looks like the atrium where it is. You can see the you can see the branches of the pulmonary veins and the arteries. See the pulmonary veins here, the artery, the right atrium. So you can see that the pulmonary veins transport oxygenated blood from the lungs to the right atrium. And the only pulmonary vein which carries oxygenated blood in adults, it has 4 entrances, all of them from every lungs has 2 blood vessels bringing the blood there. So we have the mitral valve. The mitral valve is from the word mitral. When you put it like the coffee of hope, that is how it looks like. That is the origin of the name. Then we have mitral valve is a bicuspid valve or mitral valve, left atrium, there's left atrium ventricular, or mitral valve is left-sided, open to the blood vessel flow to the right atrium to left ventricle. And it looks like that one. That is left atrium, left ventricle, left atrium. Then you can see that it receives oxygenated blood from there, from the left atrium, left ventricle, out, and you see that mitral valve is strictly it is never regurgitating except in any other valve like tricuspid where some amount of blood can regurgitate, but the mitral valve does not regurgitate. Does not regurgitate. You can so aortic valve opens to the left to let blood flow from left ventricle to the aorta. You can see it out the aorta. Okay. Opens to the aorta. So aorta delivers blood from the systemic and the coronary circulation. Blood from systemic and coronary circulation. So we have the heart valves. We have atrioventricular valves and the atrioventricular valves. That is the tricuspid valve. The tricuspid valve is atrioventricular valve. An example is the tricuspid valve, which has condio. You can see the anatomy, you can see the ventricle, you can see the papillary muscles, which owned this tricuspid in position. They are supported, and the valves are supported by condio, tendini, and then you can see so the condio and papillary muscles are very important because they have to be visualized when you're doing echocardiogram. Okay, so this is the rears of the heart. You also should remember this one. The rears of the heart is very important because of checking the hypokinesia, or dyskinesia of the heart muscles in cases of ischemic heart disease. So it is very important. You can see the pericardium. Those are the fibrous tissues. You can see the pericardium, cilious tissues, and pericardium space, which is filled with pericardial fluid. And this is where pericardial fluid effusion takes place. You have the visceral pericardium, and which has adipose and plus the epicardium, plus myocardium, and endocardium outside of the muscles of the heart. Okay. So the walls of the heart consist of three layers. That is the epicardium, that is the external layer, the myocardium, the middle layer, the endocardium, the inner layer. So you can see all those ones there, the cavity. The pericardial cavity is in between the pericardium and the pericardium and epicardium. Myocardium and endocardium, all these ones, you can see them, they are very well. Now, this is how the blood flows to the heart. You can see those valves well visualized. There you can see the pulmonary artery, tricuspid valve, mitral valve, and then the aortic valve. Here you can see the left, the muscles. You can see how the lining of the blood vessels, all of them. And that is how it looks like. You can see the right atrium, the right ventricle, the left ventricle, the right atrium, the mitral valve, the ventricular septum, atrial septum, and also tricuspid valves. All of them, you have to visualize them in a good way. So in a echo, you have to remember that echo, it shows a reflection like a mirror. In a normal heart, the left ventricle and the right ventricle are on the lower side, but when you do a echo, they are transmitted the other way around. That's the reason you see that the left ventricle and the right ventricles are arranged. So the upper part is the apex of the heart, the lower part is the upper, the left atrium and the left ventricles. You can see the interceptor. You can see there is in this type of ultrasound there the interceptor. The right atrium and left ventricle is communicating. You can see that there is also a dilatation of the left ventricle. So you can see that that is how the blood flows in this heart. How this blood flows in this heart. How it flows in the heart. In summary, you have to know about the inferior vena cava, the superior vena cava, the pulmonary vein, the tricuspid vein, the left atrium, pericardium, mitral valve, pulmonary valve, all these ones. With all these basics, then you should be able now to do ultrasound of the heart, and you can be able to spot various problems there. Now, thank you very much for listening to this one.